Mhm. Does the problem have wider reference? For example, with our doctors, it could be if we don't have enough doctors right now, maybe in some time in certain area, if we don't have enough surgeons, maybe this problem will be widened, and in some time we'll not have enough general practitioners, something like that. Are similar issues found in other contexts? It's bridge for the next publications. If you want to continue your work, your studies, you're totally okay to address a connection in conclusion for next publications on some other similar topics. How we were solving the problem, advanced understanding of the topic. It's a description of results in our paper. So we'll describe how our solution exactly working. What benefits will it have for future research? I already said that it's related to our future publications. Does the problem have direct or indirect consequences on society? It's a good question for our aim of the work. So we should say that if we don't have enough doctors, there will be serious problems with our society, because we will not be able to treat patients or something like that. Okay. Okay. So after going through these questions and thus answers, we are able to determine the aim of our study. So in our case, which I was using today as an example, we will say that the aim of the study is to determine how exactly telemedical services are able to help our problem with the lack of doctors in our clinic. Okay. I guess it's all in this short website. I'm not sure that you really need this link, but anyway, I will share it. Okay. Okay. My next idea was to go through your areas of interest, and if you are not already entered, you have not already entered your title, I will help you with some insights. So how I am doing it. I check your specialty and area of interest. For example, telemedical technologies and maternity. And this is what I found. I have found what we have. We are able to talk how telemedical services are able to reduce are able to help in high-risk pregnancy. So what could be done in this situation? Another way will be to talk about telemedical help, about care for newborns. Yes. And in each area we have description of different types of solution. For example, it could be using some mobile device for patient remote monitoring. So I guess it will be quite enough for our title. So a combination of maternity and telemedical technology could lead us to the title Introduction of mobile devices to help in high risk pregnancy monitoring, analysis of the technologies to help with high risk pregnancy monitoring, something like that. I have some more ideas. Assistive technologies. I guess we talked on our previous session about assistive technologies, and it's quite easy to make a good title right here. So you just it will be just enough to name one medical problem and one type of assistive technology. So it could be anything from this list. What example I was going? Oh, I have a few questions in the chat. Okay. Telemedicine is postpartum care is your topic. It's a great topic. You just need to be a bit more specific with exact technologies which you are going to use. I will check something. Screening treatment of depression. In my opinion, it is a quite wide area, and you should be more specific and name one of these topics exactly which you should be should make your work in. So it could be therapy appointments, screening treatment, birth control consultations, something like that. So I will share this link with you and just check if something will be interesting for you exactly, and your work will be more narrow and it will be much easier for you. You will not need to analyze thousands of publications in this area. So my advice is to go deeper in details until your topic will be covered by about not more than 100 articles already published. It shouldn't be more because it will be difficult for you to analyze a bigger number of articles. Okay. Can I get a link for assistive technology? Yeah, sure. It's I'm not an expert in assistive technologies, and it's just a first link from Google on this topic. Okay. I'm not trying to discover the whole area in 5 minutes because it's impossible. Yeah, I understand. I'm just advising you how to reach your task to specify your title, because in some cases it is not an easy task. Okay. What I was going to talk about next, it's about telemedicine and nursing. In this list, I found a few of you whose specialty is general nursing and area of interest is telemedicine. And it's quite interesting because for nurses, telemedical technologies could be a bit different than to the doctors. And it is an interesting idea to describe telemedicine from nurses' side of view. And there are several interesting insights in this article. For example, well, I like this passage. For example, in some cases, nurses are monitoring patients' heartbeat and lung function hourly. So it's just a perfect case for mobile monitoring device, which will do this automatically, and it will save a lot of time for nurses. And I could be wrong here, and I'm not an expert in nursing, and in my opinion, it is a good idea to introduce mobile devices, or, for example, for patients which are not mobile, we could use video streaming solutions which will assess position of the patient on the bed. If you have moved or something fell or something happened near the bed, we do not need to have a nurse all the time nearby to monitor. Current technologies are able to provide us a solution when we have a video camera and a program analyzing this video stream, and if something important have happened on this video, it will send an alert to the nurse to come and visit this patient. And actually, it's an example from our current work. We made such a solution for our patients in Russia, and it's quite useful in hospitals to monitor such patients. Yeah, and you are totally welcome to describe this technology that could be used in a certain specific way, and talk about benefits and risks of implementation of such technology. And once again, I will repeat that I am not advancing you to talk only about good sides of digital technologies. We should always remember risks and talk about risks, not nonetheless than about benefits. Okay. What else? It's about telemedicine in general. I guess I was going to make an illustration that I guess this page I was going to show you after I saw a lot of telemedicine in area of interest, and I like this page because there are a lot of different implementations how exactly telemedicine could be introduced. For example, it could be interactive, could be remote patient monitoring. We already talked about this. Store medical data, mobile phones, mobile applications. Also, we are able to talk about advantages, increased access. It's very important because in many cases we need telemedicine because it's physically impossible for the patient to visit his doctor. For example, he's far away, or he's in area disconnected with mainland or something like that. Reduced exposure, and it's also very important. For example, during coronavirus, I will make an example from Russia. One of the main numbers in the death call were from doctors, because they were always exposed. Not only doctors, of course, nurses also, all the medical practitioners were exposed to the virus, and the biggest number of deaths was related to medical practitioners. Reduced cancellation and non-shows. I guess it's about that for patients it's easier to make an appointment and to follow this appointment during a video call rather than to go to the doctor. It's an area to discuss, actually. Encourage better choices. I'm not sure what it's about. More effective communication, patient education. It's a good example, actually. Patient education is a very important area, and in my opinion, it's not covered as it should be by doctors. And Mobile applications, for example, could really help here because in many cases we could use some gamification tools to make the process of your condition monitoring as a game, as something interesting everyday activity. For example, it could be application which will provide some advices, provide some news or some funny pictures of the cats, I don't know. And by the way, we'll ask our elderly patient, is he feeling fine today? What's his blood pressure or something like that? And as a result, it will increase healthcare. Actually, now I think that I understand about where is this point? Encourage better choices, and it's also could be done with gamification. And for example, if we measure calories and we need to be on a diet, such a tool could advise us that we should eat some vegetables and not a cake today. Streamline process, it's something difficult. Increase collaboration among departments. I'm not sure that it could be described in our publications. Security risks. Security risks are a very interesting area of telemedicine, and there is a lot of questions to talk about here. Regulatory complications, and this is the second most important areas which result in not as fast introduction of telemedicine as we want to, because there are a lot of regulations, and in many cases doctor will be totally good to talk with his patients with a mobile messenger as a private talk, but if we'll name that today your private talks with your patients are not private talks, but it is a medical advice, all of them will say, oh, no, we're not getting paid for this, we're not able to make a decision during this talk, we need to see this patient in person in our clinic, make all the analysis, and results will be in decrease of introduction of this technology, but not in increase. So it's a good area to discuss. Technical challenges. I'm not sure that it is a good part of telemedicine for you, but maybe some of you will be interested in some technical solutions and we'll discuss them. Why not? It's quite interesting. It's a very wide area actually, because there are a lot of technologies, a lot of standards, a lot of devices, so there's a lot of things to discuss. Licensing issues, it's close to technical issues, but about licenses for software, I guess. It's not about, I guess, for licensing for medical services providers. Yeah, it's very important because there are situations when we have advertisement in internet that you are able to make a call and we will answer all your questions. And as a result, there are people on the other side without medical education, and it's inappropriate use of telemedicine. Data issues, it's close to security risks, and it will be good if you will cover them in coverage and costs. Loss, history, it's for some reason, I don't know why, each year there is a student which is interested in history of telemedicine, and there are a lot of publications about history. I don't know why. What else? So on this page we have a lot of bullets to make your interest in telemedicine more specific. So you are able to choose just one of them and focus on it. I shared this link in the chat. It would be helpful for you. To continue this information about how we could be more specific, I was going to show you this page. It is emerging technologies in telemedicine. In my personal opinion, the best way to make an article, or maybe something more than an article, is to cover emerging technologies, because I don't know, maybe it's most interesting just for me, but I think it could be possible that it is interesting for many of you also. Why artificial intelligence is on the table right now? We have a lot of progress in this area, and in medicine, the main problem was that we don't have enough data in digital format. And when we are starting using telemedicine, suddenly we have a lot of medical data in digital form. So as a result, telemedicine will possible to advance our artificial intelligence solutions. So I will cover this idea a bit further, but in general, we could think that why exactly we need to have a human doctor on the other side of the wire, yeah? And maybe in some corner cases, we are able to replace human with AI when we are talking about telemedicine, because for the patient it could be, doesn't matter if we are sure that this artificial intelligence will produce results as good as our human doctors, or maybe even better. Why should we bother and distract them from their work? And we could use such technologies here. For example, it could be chatbots, and right now, me personally is working on chatbots implementation for healthcare advices as a part of the medical services. So another emerging technology is augmented and virtual reality. And it is something good to describe. And I guess it's quite difficult because virtual reality itself is quite difficult. But if we add there also all the medical problems, it could be too difficult to describe. But as an area of interest, it's a very important one, and maybe you will be interested in it. Telerobots. I don't know. I do not like this area a lot because, in my opinion, it do not provide anything specifically better than just a mobile application, but maybe for elderly or kids it could be quite interesting, and such robots could be useful. Why not? I think it's possible. Internet of Things and nanotechnology are also a great area to be covered in telemedicine. For example, when we have mobile medical devices gathering data from our bodies on a very short scale, and it's also very interesting. 3D printing. When I saw this article, I didn't understand how 3D printing could be connected with telemedicine. it's an interesting story about patient which have the heart problem, and data about his heart condition were transmitted to the facility, where they were able to print some part of heart to be installed after that. So I'm not sure that it should be in the area of telemedicine, but why not? I guess it could be interesting. I will also share this link with you. Maybe it could be a good idea for one of you to make your telemedicine more specific. Yeah, this page I opened when I saw, oh, sorry, I will reduce the letters in this. Okay. I saw e-ink and tablet history entering area of interest, and I found this page about how e-ink could be used in healthcare. Actually, I didn't saw this before, and in my opinion, it's a very interesting area, and it could be a very good publication, because this combination isn't very common in this area. So if you will describe how tablets on e-ink could be more beneficial than other types of devices in healthcare, it could be perfect. Yeah. I will also share this link with you if you didn't saw this before. So I guess I told you everything about telemedicine, and I saw also two areas of interest about artificial intelligence and no paper titles. So I was going to say that it's very easy to be specific in artificial intelligence. You just name a medical problem and add their artificial intelligence, and you will be able to find a solution which could be created. It's covering all the areas right now: cardiovascular, dermatology, gastroenterology, infectious diseases, oncology, and so on and so on and so on. I'm not going to go deeper in each area. There is a lot of information. Disease diagnosis, intersection with telemedicine and the AI, electronic health records, drug interactions, what else, and solutions from industry. Yeah. So you should just take a look on this list, select what area medical problem is more interesting for you, and which technology could be more interesting for you, because this is only application part of artificial intelligence. On the other side, we have a lot of technologies and technological solutions which could be also described in your paper. So if you want to make a good work about artificial intelligence in 2023, you will need to be very specific, because there is a lot of applications. And my advice here will be: name a medical problem, name a technology, name how it could help, and after that it could be a good title and good area. Yeah. Actually, I'm done. All that I was going to say to you, I covered. I guess you will enter all your paper names, paper titles in this spreadsheet, and I will check them till the our next meeting. I will provide you feedback about them if something should be adjusted, and I will ask you to specify problem and solution. I will check how I should write the word hypothesis. Sorry, it's like that. Yeah. You will specify your vision of problem and solution. And I will say that's a of the work. Yeah. Okay. I guess. Oh, there is questions. Great. I will check them. Other telemedicine interests in anesthesia and ICU medicine. It's a good question. I'm not ready to answer it right now. If you don't mind, write me in WhatsApp same question. I will search for some examples and will share them with you because it will take some time for me. Okay. And I will answer to you how I found them. And we will also discuss this question on our next meeting if you will remind me. I don't have a answer for this question in my mind right now. No, just one insight. If we have a medical situation when our anesthesiologist is not reachable right now and we need emergent situation with a patient, we need to apply anesthesia, we are able to make a doctor-to-doctor consilium and get insights from anesthesiology specialists from another clinic. It's one example. Another example could be when there is a problem with anesthesia or with our patient and we need to communicate with some professional on who had the same situation in his experience, and it also could be used as doctor-to-doctor consilium. Is the link for the last page possible? You are talking about artificial intelligence? Yes, sure. Okay. Yeah, this is the link for artificial intelligence in healthcare. If question to analyze about the level of awareness among doctors about telemedicine, how I can have a solution? It will be a cross study analyzing level of awareness. I guess you should name a problem here. Problem, from my point of view, problem will be that the pace with which telemedicine is being introduced in your region is too low, for example, and you could check if this is related to distrust to this technology, and after that you will analyze if it is related to attitude toward this technology. So after that, you are able to think how to improve this technology or this attitude, so doctors will accept this technology and to use it in their work from day after day life. What's next? I mean, the link to website of telemedicine in different fields of medicine. I didn't share it in different fields of medicine. I guess it was this one. Yeah. And this one about telemedicine in nurses. Yeah. First, we're going to learn about data analysis software in this section of MPH. About data analysis software. I will check with our lectures plan. I'm not sure that there was a software for. Actually, it was there. It was about statistics and from the point of view of statistics. And if we talk about data analysis in general, it's hard to say that we have right now an exact software. In many cases, tools for data analysis are being made for the problem itself, and they are custom-made tools. And actually, right now we have several projects related to data analysis in healthcare, and all of them are related to creating a software tool on Python using different libraries to analyze data, to make it predictions based on some spreadsheet data, or make prediction on medical images. So it's a very deep area to study, and in general, eHealth course isn't covering these technologies. It's about introduction, how these technologies could be used. But of course, it's impossible to learn how to create such technology in such a short term. But I can give you some insights which way should you proceed with your education if you are interested in this area. Yeah. Software, but I will think about maybe I will name some tools which are already made and could be used. Yeah. Okay. Okay. So thank you very much. Oh, one more question. Sorry. I have seen people use R and Excel for interpretation of data. Could we learn about it? Yeah, sure. It's just what I was talking about. I am not able to teach you how to write a program to analyze data using R, but of course I will. I'm able to describe you how data analysis using R could be used in eHealth. Actually, it should be covered in one of our lectures. It's related to artificial intelligence because we need to analyze data not just to make this analysis. It's being used as a tool to make our prediction model and to use machine learning as an answering tool here. Yeah. I will think about how to describe this area deeper. Yeah, thank you for your question. Maybe I will write additional lecture covering this area. Yeah, it's a good idea. Yeah, thank you. Will we have practical exercises in informatics or health data analysis in this course? I'm sorry, but I'm afraid that data analysis require initial education in SQL and Python or some other programming languages, and our course is an overview about technologies. And if you are interested in these areas, I will think how to make our course a bit deeper in this area. Maybe we will add some lectures to this part. Yeah, this question also in the same field as the previous one. Yeah. Okay. Thank you very much for your active work today. You give me a lot of